Anatomy is very important for the professionals who all are working in medical field. If you know the anatomy, you can do anything. For example, if you go to the hospital, saying that you are having the abdominal pain. So what the physician will do? He will check the your upper quadrant, lower quadrant, and he will identify the location of the pain. So what he is checking here? Basically, here physician is checking the anatomy. Where is the exact location of the pain, and based on that location, he can diagnose what are the parts or anatomical organs situated on that site where there is a pain. So in the same way, for medical coders also, anatomy is very important. If you know good anatomical skills, you can master in ICD-10 PCS as well as CPT coding. And also this anatomy is very important for ICD-10 CM coding also. For example, if you want to code fracture coding using ICD-10 CM, there you need to know the anatomy of the body organ where you want to code for fracture. So without any delay, we will start our session today. So medical anatomy for medical coders, the foundation for accurate and efficient coding. If anyone looking for pre-APC CU webinar links, medical coding jobs in India, USA, UAE, join in our WhatsApp group. The group link is in the description of this video. Always our intention is to share knowledge and gain knowledge. If you are visiting for the first time, please click on subscribe button to receive future updates. And also, if you want to know why anatomy is important medical coders, please watch this video until the end. And if you like this video, please click on like button in order to motivate me and also in order to create more videos related to medical coding. First, we will start with integumentary system. In today's session, we are going to see integumentary system, musculoskeletal system, respiratory system, cardiovascular system, urinary system, reproductive system, nervous system. And by using these systems, I am going to provide you with more important anatomical skills. You need to concentrate on your skills. So first we will see integumentary system. So what is integumentary system? Integumentary system includes skin, hair, nails and associated glands, which plays very significant role in coding. If you want to code for dermatologic conditions or procedures, you need to understand skin, hair, nails and associated glands very well. In order to code using integumentary system, as a coder, we need to master layers of the skin and types of lesions and common conditions such as psoriasis, eczema and skin infections. And also most common procedures in the integumentary system includes biopsies, excisions and wound care. So what are the key anatomy you need to learn in integumentary system? First, you need to know skin layers like epidermis, dermis and subcutaneous tissue, which are the skin layers. Then you need to understand skin appendages like hair follicles, sebaceous glands and sweat glands. Next, you need to master types of lesions like macules, papules, nodules as well as ulcers. And also you need to master about common skin conditions like dermatitis, acne and fungal infections. Why means while coding most of the time 99% you will encounter all these words. So if you want to master in integumentary system, you need to master skin layers, skin appendages, types of lesions as well as common skin conditions. Next we will see musculoskeletal system. As all of us know, musculoskeletal system consists of bone, muscles, joints, ligaments and tendons, which is the more crucial area for the medical coders. So in order to code from musculoskeletal system, each and every coder need to know the names of the bones, names of the muscles, names of the joints and names of the ligaments and tendons, as well as most of the time we need to know the definitions of what is a muscle and its purpose, what is a ligament and its purpose, and what is a tendon and its purpose. If you don't know the meaning of all these terms, please mention in the comment section that please provide video on muscles, joint, ligaments and tendon so that I can create one video related to all these. If you want to code for joint procedures, so you need to understand the location of the joint and type of the joint as well as the bones involved in that joint location. So what are the key anatomy to know in musculoskeletal system? First of all, we need to understand major bones like femur, tibia, humerus, radius, ulna and vertebrae. And you need to know joints like shoulder joint, knee joint, hip joint, elbow and vertebral joints. And also muscles like deltoid muscle, biceps muscle, quadriceps and hamstrings. So most of the time if you are coding for shoulder procedure, 99% you can see biceps muscle. Our most common procedure using the biceps muscle is biceps tenodesis, which you can see in the shoulder procedures. Next, we need to understand ligaments and tendons like ACL, PCL, Achilles tendon. So ACL means anterior cruciate ligament. PCL means posterior cruciate ligament, which presents in the knee joint. Next, we will see respiratory system. Most common respiratory conditions we will encounter during our medical coding processes, COPD and asthma. If you want to code procedures using the respiratory system, you need to master anatomy of the lungs, airways and related structures. And this anatomy will useful for the procedures like intubation, bronchoscopy and thoracentesis. For example, if you want to code procedures on lungs, here you need to understand what is pneumonectomy, what is lobectomy, what is bilobectomy. So these are the anatomical terms you need to master if you want to code respiratory system chapter. And what are the key areas you need to remember in respiratory system? First, you need to remember airways like trachea, bronchi and bronchioles. Next, you need to remember lung lobes like alveoli and pleura. Next, you need to master diaphragm, primary muscle for respiration process. And also you need to master accessory muscles like intercostals and scalene muscles. So thanks for visiting our channel. If anyone looking for same-day surgery coding training, please send WhatsApp message to 707-526-3939. And also please like, comment and subscribe if you like this session. And also if you are having concerns related to medical coding, please mention in the comment section of this video.